Welcome, everyone, and thank you so much for joining us early this morning. My name is Jennifer White, Senior Community Engagement Officer at the Horizon Foundation, and I'm also joined by Glenn Schneider, Chief Programs Officer at the Horizon Foundation, who will also share with us. The purpose of this call is to highlight a key advocacy opportunity related to the 30-school pilot program that would deliver school-based mental health services to our students in Howard County Public Schools. And so during our brief time together, as we move through the agenda, Glenn will provide a brief introduction to the Horizon Foundation, provide an overview of why school-based mental health matters and the importance of advocacy. I'll then pick up and share how we can all participate and take action, provide background on the budget timeline, describe next steps, and then we will move forward with your questions. So Glenn.
Thanks, Jennifer. Thanks for all of you tuning in virtually or in person. I thought I would start with a little bit more a sense of what the foundation is and what we do for those of you who aren't as familiar with the foundation as others. I think first and foremost, we look at our role as leading community change so that everyone in Howard County can live longer, better lives. And our mission is, of course, to improve the health and wellness of the people that live or work in the county. Over the past 21 years, we are your community health foundation. We've given out nearly $60 million and supported more than 300 different initiatives to improve community health. And how do we do this? We do this through the 4 Ps that you see below. The programming work that we do in partnership with all of you grantees and our other formal partners outside of grantees. We do this through policy. Policy and systems change is extremely important to having success. We work with partners through our grants and partners through just the organizations in the county that provide such great help and efforts in improving health. And lastly, because we are a community health foundation, we also have the ability to invest in evaluation so that we can tell if we're actually moving the needle or not and how we're moving the needle. We think it's very important that we invest there too. Our strategic priorities, we have 3 of them. Supporting healthy kids and families is mostly physical activity, nutrition work, and mental health for children. Promoting healthy aging is our work with Speakeasy and advanced care planning, as well as adult mental health. And lastly, ensuring a more equitable community is really structured across all of our priorities to make sure that we are having impact with populations that have historically been underinvested in, not had the same ability to have success as others. We really feel like we can do a better job at tackling the health disparities that exist here in Howard County today. Perhaps you've heard of us before, hopefully. We have been working in the community, as I said, for 21 years. We have a host of initiatives that we've been working on throughout that time. More than likely, we have interacted with you on more than one of these at a time, and we are excited that you are among our partners. So what got us into this mental health sort of priority for us is very simple. It's the data. The data shows pretty clearly that at least 1 out of every 5 children in Howard County today are likely to have a mental illness throughout their lifetime. The thing is that 50% of them will start showing signs of this by the age of 14 and 75% by the age of 24. That means that if we are doing our job and actually telling when children are starting to have symptoms, we can intervene and do something about it early. The problem is that we aren't so good at that. As you can see from this slide, it takes usually about 10 years from the first time that someone might see a sign to the time that a child gets intervention. That is far too long. That's certainly what got us interested and involved in mental health, and it's certainly something that drives us today to bring that amount of time down. So what happens if we do a better job? It's very simple. Kids do better in life and kids do better in school. We know that children are more resilient. They're more able to face the challenges that they have going throughout their school career, but even afterwards, if they go and get a job or go on to college. We also know that children do a whole lot better in school, both on their tests and their standardized tests, making them a better student and more able to learn. So if we think about this, where do parents seek help if they think that their child might have a mental illness or might have mental health challenges? And there are really two key places. One is their pediatrician's office, and the other one is school. We're going to talk mostly about school today, but just so you know, Foundation is doing quite a lot of work to make sure that pediatricians have the ability to embed behavioral health consultants, usually social workers or psychologists, in their practice so that they can offer in real time the kind of treatment that children need when their parents and them come to the pediatrician's office. Know that we are doing that, but we're talking today about schools. I think our partners in school health, of course, include the Howard County Health Department and the county in general. Of course, the Howard County Public School System and the foundation to think about ways that we can do stuff together to fund really exciting pilots and innovations in this area. And of course, I would add to that all of the grantees and all the partners that we're talking to today who are joining with us virtually or online. We are also, of course, relying on all of you as partners in child health to make sure that we can do the best by our children so that they have great opportunities to succeed. Howard County School System has been doing a lot of mental health work for a very long time. They've been a very good partner. They have done certainly curricular changes over the course of the last number of years. They have plenty of staff when it comes to school psychologists and social workers and guidance counselors and others who can help, including teachers. And they also do a lot of work on early intervention. But there was one thing that was missing that recently we changed and added to that mix. And these new mental health supports that we've added to the school system are not only fundamental, they're essential. Actually, that probably means the same thing. So what do we have? We have 30 schools that are a part of a pilot, along with Head Start, to make sure that children have the one-on-one counseling that they might need in order to be successful. In 30 schools, that means that whenever a child is having any sort of issue identified by their parent, by a teacher, by staff, by a bus driver, by janitorial staff, you name it, if there is an issue that might need help with, they can go ahead and refer to the school-based mental health program that can get a child the help that they need. This is a big deal. It's a part of the overall school offerings of mental health resources. We will actually send out this fact sheet to you that describes this current pilot that I'm talking about now after this program so that you have access to it as well. But here's the amazing facts about this. This is why this is so important. Nationally, only about 20% of children who need the kind of mental health help that we're talking about actually get the help that they need. Only 20% are seeing a clinician outside of school. 75% of the people who end up getting help get help in schools. That's nationally. And up until 2 years ago, we didn't have that capability in Howard County, and now we do. And that is a big, big deal. Why is it so important that we offer one-on-one counseling in schools and the kind of help that we're talking about through this pilot? It's very simple. It reduces treatment barriers. Number one, you don't have to go ahead and come out of school. You don't have to have transportation problems that make that a problem, or a parent who needs to take off work. And of course, you don't have to wait in long lines at a clinician's office waiting for treatment. In fact, what it allows a child to do is simply, with permission of their parents, the ability to go in and see a counselor one-on-one during school hours in a way that makes sense for them. And it eliminates all these treatment barriers that otherwise makes it really hard for a student to get the help that they need. Here's the issue. This program is very much at risk. As you might know, the county budget is always tight, but particularly this year is tight, especially given the COVID era that we live in. Right now, the budget that was introduced is about $30 million less than what the school system asked for. And that means that it is likely, unless there is some major additions to the budget, it means likelihood that there's going to be cuts somewhere. And we're concerned that this would be among the programs that the school board might consider cutting. Why does your advocacy today matter for that? I want to tell you a quick story. You might recognize this person here on the screen as our dear old previous Congressman Elijah Cummings. who is a dear friend and also an amazing representative of the people here in Howard County. Elijah Cummings, before he went to Congress, was in the Maryland General Assembly. And I happened to be at a meeting where someone asked him about the importance of public engagement when it comes to policies and systems that they were changing at the state level. And what he said has always stuck with me, and I think sort of guides us along this pathway of why this is important. We asked him, why is advocacy important? He said, let me tell you this. We politicians, we live or die by what we know from our constituents. They guide us in this path. But unfortunately, usually on any given topic, if we get more than 10 letters or 10 communications or 10 phone calls or 10 visits on anything, it is a landslide of public opinion. I want that to sit for you for a second. Imagine if everyone is listening to this right now and all of their friends and all of their family living here in Howard County chose to take the next step and take action. Imagine what we'd be able to do to really change the way things are done in our particular community. That's the potential for us today, is making sure that this essential program that is offered in most communities across the state and across the country is continuing to be offered here in Howard County, and that over time, after this program proves itself, that we are able to expand this to all the schools in the county. That's the important part of what we're talking about. It's not only the promise of today and the need for this program right now, it's about the need for this program in the future to serve all children of the county. So with you, we get to think big. We get to think about these big, major sort of problems and these big, major solutions that we can form together. That's why we need your help. That's why we're reaching out to you today to be a part of the solution. I'm going to turn it right back over to Jennifer to take on from here.
All right, so as Glenn shared, this is a new 30-school pilot program that will deliver school-based mental health counseling via community providers. And now more than ever, protecting funding in the FY21 HCPSS operating budget to provide these mental health supports is critical. And due to the unforeseen shifts our county is enduring, we know budgets are tight, which makes this investment in the health and social, emotional well-being of our students at risk, which is why we need your help. And so you can take two steps to take action in these ways. And so here is how you can help, and this is where everyone can participate. And so the first way is an opportunity for you to click on the embedded link here or in the correspondence you previously received, where you can send a message to the Board of Education to protect this investment. Again, this is an opportunity for everyone to participate with that first option. And then secondly, we drafted a letter that will be submitted as testimony to the Board of Education. Because we are unable to attend in person, having a vast number of signers will be just as impactful. If you are affiliated with or a part of an organization, we encourage you to share this correspondence with your leadership and sign on to this joint letter that will be sent to the Board of Education in time for the May 7th Board of Education public hearing. Again, these are the two ways to participate, and so send a message and sign on to a joint letter as an organization. And so moving on, just wanted to provide you with a bit of background related to the Howard County FY21 budget timeline, is specifically relating to the Board of Education. So the County Council will host a virtual budget hearing on the operating budget on May 6th at 6:30. If you or your organization would like to testify, the link is embedded here for you to sign up. In addition, the Board of Education will host their virtual public hearing the next day on May 7th at 7 p.m. And again, the link to sign up there is also available in this PowerPoint. As you can see, we're in the final stretch of the budget process. And on the 28th of May, the Board of Education will adopt the budget at 3 o'clock that day. And so again, it's very important that just given the timeline of this budget, this is why this push is critically important to informing how the Board of Education will finalize the budget for FY21. And so here are a few next steps. Moving forward, we will send a brief follow-up email, which will include the links to take action, the resources that Glenn referenced, the Zoom link to rewatch this info session, as well as the presentation. And the most important thing we want to leave you with here is that the deadline to sign on to the letter is by the end of the day on Wednesday, May 6th. Again, the deadline to sign on to the letter is by the end of the day, Wednesday, May 6th. And then after the budget is adopted, we will send out correspondence and have a brief update. For some of you, this may be your first opportunity in taking advocacy action, while others, you may have been on the battlefield for some time. And so we hope that within this particular space, that this will be a launching point for us to continue working with you in order to move forward with this advocacy for HCPSS as well as beyond. And so we'll take a moment to answer your questions and ask that you would put those in the chat box. So again, we appreciate you and thank you for rising early with us and joining us today. We appreciate your questions and comments. And again, we wanted to provide you with a brief overview of this critical advocacy opportunity for our Howard County students. If you have any other questions or would like additional information, please do not hesitate to call me or Glenn, but my contact information is listed here. We again do appreciate you, and we hope that you have a wonderful day. Thank you.
Thanks.